your A game.
Am I bedazzling? I think I'm if I'm not bedazzling, the hat is. Okay. Okay, we're ready. Very
All
serious,
right,
serious face.
wow.
I'm a doctor.
A double certified.
I know. I'm very fancy. I'm very fancy.
Work shouldn't be this much fun.
Should absolutely.
Hi, Boots Knighton here with Dr. Kelly Sadauckas, and we are bringing the pelvic floor game to you this month for Heart Month. I hope you've enjoyed everything so far. This is episode 4. We released a special one on Friday, Valentine's Day, on Sexy Time. So if you missed that, be sure to go back and catch it. We kept it short and sweet, but if you are able to get a video of this somehow, I know a lot of you just walk around and with me in your ears, and thank you, I'm so honored. But Kelly is rocking a poop hat in honor of our topic, which is pooping post open heart surgery. I'm going to do my best to be professional here and also a human at the same time. And I look at my friend in her poop hat. Yes. So welcome back, Dr.
Thank you,
Kelly.
Boots. Thank you so much for having me, Boots. It's an honor to be here. And part of the reason I'm wearing this hat is sometimes I can't believe it, but sometimes people don't like to talk about poop. I don't know, but it is something that literally everyone poops. You poop, your parents poop, your friends poop, everybody poops. And so it is something that we really should feel comfortable and confident talking about. And poop is significantly and uniquely correlated to quality of life as we age, and especially as we have big, scary surgical procedures. So the more that we can make it not so scary and uncomfortable to talk about, the better. So, I mean, me and my silly poop hat, like if this helps you be able to think about how often you're pooping or how much fiber you're eating, like without getting all queasy, then great. I'm so happy to be able to provide that. So, to set the stage.
Love it.
Yes, like to set the stage of why pooping is important. Boots, tell me about your poop experience post your surgery.
Yeah, it was epic. I couldn't poop for a minute there, and we hear about that a lot. Like a lot of times stool softeners are prescribed post any surgery. And I went to the hospital expecting that. So I wanted to be able to have a more natural experience. So I brought like a special tea called, I think, Smooth Move.
Yeah.
And by the time I drank it, I knew how important it was to go for like process post open heart surgery. And so I overdid it. I drank 2 glasses of it, so 2 tea bags. And let's just say it worked exceptionally well to the point that I needed to utilize the services of all the CNAs on the floor. And then what that did was it was embarrassing. It was in the middle of the night, which I mean, they're there to work, but like I was so tired. I needed to be sleeping. I had made a mess. It was just really so uncomfortable, mind, body, spirit.
Absolutely. And so, and we can't promise like, oh, had you known this, that it would have been different, but it might have been. And, there's going to be listeners where this will make a difference for them. So, we are going to have some fun. Okay. Quick question. If I show this to you, is it the right direction or is it backwards, Boots?
It's the right
I think
direction.
It's the right. Oh my gosh. Cameras are amazing. So not very many people understand. Not very many people understand what poop is. And so we are going to start off just explaining to you how your amazing, beautiful body makes poop in the first place. And along that journey, we are going to discover some ways that we can set ourselves up for success for the best post-operative poop ever. Now, as with most things, the best time to start preparing your body for the first post-operative poop is like 2 months before your operation, right? And not everyone,
Months?
I mean, or 20 years. Like, we wanna get poop perfect as soon as our lives as humanly possible. The second best time to improve our poop function is right now. So if you're listening to this and you're 20 years old, medical student, heck yeah. If you're listening to this and you're 70 years old after your first surgery and you're terrified, heck yeah, welcome. This is going to help everybody. So those of you that are just listening, I'll take some amazing pictures of this, and Boots, we can put them in the show notes so people can download. But my first picture is all about poop. Ooh. And the first thing that's involved in poop formation is what food and water go into the system. Friends, if you're not eating enough food, you are not going to be able to poop. Okay? Food is fuel for your beautiful body. So we got to get fuel in. If there's no fuel in, you will not have stuff to push out in the poop. Additionally, we need enough water. If without water, we are going to not have great cognitive function. Our bladder is going to be pissed off, and we're going to have little rabbit turds. Without enough water, we will be constipated. How
And
much
if
water?
I could just interject,
Yeah.
let's go back way to like Super 101. Like
Yeah.
pooping is so important because it
Yes.
gets toxins out of our body,
So,
right?
yes. Yes, but more importantly, pooping is a reflection of how well our microbiome, and I will take that even back one step further in a second, how well our microbiome is digesting our food to actually give us nutrients. So the step further, we've got, and that's kind of down here. The microbiome is a biota. It's little tiny bugs, not bad bugs, good bugs, that live inside the tubes in your stomach, and they help digest the food. When they digest the food, that's what makes these nutrients available for us to actually receive nourishment. And guess what? Those good little bugs that live inside of us, they need fiber. Fiber feeds your microbiome. So if you don't eat any fiber, fiber's not just the stuff that forms the poop, it feeds your microbiome. If you don't eat any fiber, there's a chance that food could go through and you're only pulling out a little bit of the nourishment. So that's not okay either, right? Like, all of us, I think as I go through this full thing, that particular part will make a little bit more sense. So the food that's going in, we need enough food to actually form poop. So that's the first thing we look at. And as far as fluid ounces, we take your body weight in pounds and divide it by 2. And that is your target number of baseline ounces of water to take in a day. 75% of it preferably non-caffeinated to make sure that we're actually getting hydrated stuff. If you live in a high altitude, if you're breastfeeding, exercising, then you actually need a little bit more than that bare minimum, but that's how you find your bare minimum for what your body needs. Fiber, we want 10 grams of fiber at every meal or meal snack combo for 20 to 30 grams a day. And most Americans specifically are woefully inadequate in fiber, but that's the basic that we need. As we're going to see as we travel down the poops journey, that fiber is what's going to actually feed the good bugs that live in the tubes in our stomach to break down the food for us and get us nourishment. So food and water go in. We chew it with our very sharp teeth right here. Chewing it and the saliva starts to break down the food so that those little biota, those little buggies, good buggies, can get us the nutrients. It goes down the tube into the stomach where it gets all churned up with acid. Woohoo! And if we have a gallbladder, a little extra shot of bile to further break stuff down. And now it's like a sludge, right? I know it's very, very fabulous. The sludge leaves the stomach and goes into your small intestine, which I have shown as just a little swirly do here. The small intestine is where a lot of those microbiome, those good bugs live, and they're going to eat the fiber. And when they eat the fiber, they're going to release all sorts of stuff that helps our body break down the food and absorb the nutrients. And if we don't have enough fiber, those little bugs can't do their job. And number one, we're not absorbing the food. And number two, the speed with which the food is going through the tubes is going to slow. And that's a problem. After the food goes through your small intestine, It goes through something called your cecum to your large intestine, which is where water is resorbed. And now it's going to switch from sludge to looking more what we think poop should look like. Okay? The very end of the tube, it's going to go through your sigmoid colon, which is not to scale, but it's two 90-degree turns. Randy the rectum here. Hey. The poop comes down, and then when it's ready to be stored, before we eliminate it, it makes two 90-degree turns, and then pressure of that formed poop on the internal anal sphincter tells us if we have to fart, poop, or if we're about to have a poop emergency and run to the bathroom. Holy heck, isn't that crazy pants? And then, like, oh, hold on, Boots, I can't hear you.
I just yeah. Michael, if you could make that sound a little bit better, my internet continues to blitz. It's so annoying. I'm so sorry.
I'm sorry.
Thank you for the amazing drawing. And for those who are only listening and can't see, I'll make sure I even post some of these pictures on Instagram for you. But that's a really helpful model. And, I wonder if that's even covered in health in high school these days.
I don't even know, to be honest.
Wow.
It's certainly not covered. I went to PT school over 20 years ago. We didn't cover functional medicine, food as medicine at that point. And so much of that, people think that it's just fiber to like just form the poop. And so I'm just going to take this Metamucil. I know it's about so much more than that. It's about fueling the
Mhm.
body, And then there's a whole nother step. We have another of Dr. Kelly's famous stick figures here, like that rectum piece, that when the poop's kind of entering in that holding zone. If we are dehydrated without fiber, that poop is going to spend way too much time in that tube. I'm going to feel ucky. And then when the poop comes down, if that rectum is resting too tight, it's very hard to open the door. And relaxing the rectum, we talked about this in one of our first videos together, but we're going to recap because some people are just going to be here for the poop. They want to get the shiz on the poop. The pelvic floor muscles are like an elevator that's meant to live on the ground floor of a 4-story building. And most pelvic problems, including constipation, a part of that problem is the pelvic floor resting too tight. And that too tightness of the rectum puts the brake on all of this shiz traveling through the intestine. So it keeps the stuff in the tube longer than it should, which makes it harder. Boo. But additionally, when that pelvic elevator rests on the ground floor, which is where it's meant to be, and we can do something called bearing down, which is not straining, it is a gently blossoming of just your pelvic floor muscles. That dropping and opening of the rectum is the cue for your colon to push your poop out. So just like your bladder pushes your pee out, we should never strain to pee. Your colon should push your poop out. You should never strain to have a poop. And then technically your uterus should push a baby out. So, talk to me later about that. But if someone's dehydrated and they have this tight pelvic floor and they're sitting on a toilet that's really high and their hips are higher than their knees, that actually also makes it harder for the body to succeed. So shifting gears, if we didn't know about all of this before our surgery, and now we're really scared about the first post-operative poop, things that can help. Take the stool softener. Absolutely. In the hospital bathroom, get a squatty potty or a small stool to put your feet on so that your knees can be higher than your hips. Relax your pelvic floor to the best of your ability. Do some of these nice belly breaths where the belly gets bigger and the pelvic floor softens and drops down. And if you feel like you have to push, don't push. That's too much pressure, especially if you've had the sternotomy. So take a couple of folded sheets and push them against your lower belly, like so, while you breathe out and try to relax and blossom the pelvic floor. Those are the things that you can do to help set yourself up for success. Does that make sense, Boots? Do you have any
Yeah,
questions?
and we also talked about that the risk of cardiac events if you bear down
Oh
in
my
the
gosh, yeah. Your doctor
up
never wants
series.
you.
So mhm.
Yeah, if we squeeze, and there have been instances of people having cardiac events on the toilet when they're just trying to force poop out. And that is something that is completely avoidable if we just know to talk about it and know that there's help. And if all of this is feeling a little overwhelming, like, please don't let it be overwhelming. See this as a blessing and a gift that, oh, wow, I can't believe how much I didn't know, and seek to learn more. My online courses teach you about relaxing your pelvic floor. Boots and I, after this, we're going to guide you through a specific pelvic floor relaxation. There's probably pelvic floor PTs near you. I have a great blog, How to Find a Pelvic Floor PT Near Me. Go look at it. Email me if you have questions about trying to find someone near you, because this is something that beyond just heart clients, this is important for everyone, but it's especially important for heart clients. Now, the one other thing we can do, Boots, to set ourselves up for this great post-surgical poop or to jumpstart our poops is the best belly massage ever. Oh my gosh. And guess what? I drew something.
And you brought it. Oh man, you have really brought your A game today.
Thank you, girl. Thank you. I know. We'll make sure you guys all have downloads of these. I'll
Yep.
sign a couple. We can frame
Uh-huh.
them.
Oh
So that
yeah,
you'll
put a TM or a copyright. Mm-hmm.
Oh my gosh, it's amazing. So and those of you who are watching, you got to see this. Those of you listening, again, come find Boots's show notes because you'll get a downloadable for that PDF. But belly massage is important for a million reasons. Number one is heart surgery is stressful, life's stressful. Being constipated is stressful. Stress elevates the tone of that pelvic floor and heightens our sympathetic nervous system, which is fight or flight, which slows digestion. So, rubbing your belly, especially while we are practicing relaxed breathing, calms that sympathetic system. It helps promote rest and digest to move poop through the tube faster. So, post-operatively, you can be laying in bed, and I'm going to show this for those of you watching. You can have a hand, at the bottom of the sternotomy incision, so we know we're nowhere near there, and you can rub your sweet little belly very gently in little clockwise circles all the way around your belly button. This gentle rubbing, and you're going to do that with soft belly breaths wherever it feels comfortable for you. And if you're not comfortable touching the skin for whatever reason, do it over your hospital gown. Even the most gentle pressure will stimulate your lymphatic system, which is extremely beneficial. And doing that sunflower massage is what we call it for 3 to 5 minutes helps improve the mobility of all of the nerves that go to the colon to help make poop, and that belly breathing helps calm the fight or flight system. The belly breathing stimulates rest and digest. It helps you relax your pelvic floor, all things that are going to help the body move the literal crap through the system, right? And post-operatively, one of those might have been when your sound was going about clearing the medical crap. Absolutely. We need to get that that medicine was amazing while you were knocked out. We got to get it out of your system now. So you
Yeah.
would do that.
And can I interrupt? Because I have a
Yeah.
question. And
Yeah.
I'm thinking about everyone who's listening with me. So,
Mhm.
like for me, and this I think will be for most open heart surgery patients, I had two tubes coming out,
Mhm.
like probably at least 2 to 3 inches below my boobs, but in the center, right?
Mhm. Mhm.
And so can you still do that massage just
So
below
that's a
that?
great, yeah, no, that's a great call. I forgot about the ports for drainage. Yeah. So you
Yeah.
could, but thank you. It would just be right down here if you have those ports. I was honestly thinking more of angioplasty when we went up through the groin. Forgive me. But yeah, so
Hmm.
you would do
Hmm.
these little circles more down, again, wherever the ports are, hand on the ports, and just beneath the belly button then. Thank you, Boots. So that there's
Okay.
no tension on where those ports are coming in, right?
Hmm.
Um, If for any reason your doctor says no, again, everyone's going to be unique, then just the lightest hand pressure over that lower inguinal groin region is going to be extremely beneficial. That is one of your main lymphatic dump areas, and there's a whole lot of lymph clearing that needs to happen.
Yeah.
And then once the drains come out, then we can talk with the surgeons about exactly what happened in your case. Typically, it'll be, that light pressure is going to be allowed as soon as things are covered up and sealed. And then soft tissue healing wise, it's anywhere from 4 to 6 weeks post procedure when we would start to use kind of a deeper pressure around that area. But that's where an in-person medical
Mhm.
provider can really help you there, deciding when you can start to put more pressure. But that lower area, belly button and below, is typically fair game, right?
Okay. Well,
Hmm.
and something else that I've noticed in my own journey, I'm just thinking,
Hmm.
just a simple act, and I'm asking your professional opinion here.
Hmm.
I'm just wondering, just the simple act of putting your hand even right around the drains in the hospital and just sending it like love and talking to your body. Because, like, for instance, this morning I went to the gym before this
Hmm.
recording, and
Uh-huh.
I'm working on a few. I mean, I'm always working on something in there, but like,
As you
I
should be.
have to, like, kind of my go-to now is I like visualize the movement before I do it. And then it's
Mhm.
amazing, like, and I talk to my body parts that I'm trying to get to
Mhm.
move and at executing that movement.
Mhm.
And I can only imagine just a simple act of setting and sending an intention to that part of the body to work, get to healing post open heart surgery. I mean,
It's so
I would need to be reminded if I were like, I'm just putting
yeah.
it's 4 years ago today that I had my surgery. And I just remember how much of a fog I was in. So I would need someone
Oh,
to
yeah.
overtly remind me to do that. But like,
Yes. Yes.
we
And
have the
even
power to heal ourselves, is my point.
yes, and even just that power of your hand over the drainage spot, or just your hand or a partner or a loved one's hand on your lower belly and belly breathing. That helps show your brain that it's okay to pay attention to the body again. The brain does not understand what just happened in that open heart surgery. It doesn't know that that just saved your life. It just knows, holy shit, that was scary.
Mhm,
And how the brain's going to protect us is going to be to separate, to dissociate from whatever it can. And that dissociation is what results in a lot of these musculoskeletal changes that we can address calmly and specifically and gently, but it's, one step at a time. So yes, just that gentle hand pressure there while you belly breathe. If we don't feel comfortable touching, maybe you're not allowed to. Maybe you had something happen up the groin, right? There's lots of things that can go up the groin during these surgeries, right?
mhm.
Just putting the hand on the belly can be very beneficial. To speak to the visualization, there is so much science behind that in athletic performance, in healing, in life. When you visualize something happening, nearly all of the same sensory motor pathways are stimulated as when you actually do it. So you're helping your brain, you're visualizing standing up easy, walking to the bathroom, sit down, having the best poop of your life, standing up again. It does all of those things without the metabolic demand of actually making the muscles work. So it's great practice. And, so that is that visualization. And then it has your body practice going through that poop scenario without terrible pain, without the blowout. And that helps it gain confidence. So that is, yes, so valuable. Thank you for bringing up that visualization. Um,
Yes,
later
and
on,
I actually recorded a whole episode on visualization way back towards the beginning of this podcast because I visualized my surgery going well, and I visualized myself thriving post open heart surgery, and it worked.
so important. So important. And again, in the Western medical model, we are a sickness model. We are not a primary preventative wellness, and we are not holistic as we should be. So thank you for bringing that out to people. Now, later post heart surgery. Like, we're past 4 to 6 weeks, all the drains are out, we're doing pretty good. Then you can advance to the full-blown best belly massage ever. And that's where we start off with 3 to 5 minutes of that whole belly going in clockwise circles, clockwise around the belly button, belly breathing the whole time. And we are mobilizing skin on fat, on fascia, on organs, on muscles, on fascia, on organs, all of the things. And it is so healing. And what you're feeling for is you're feeling for these sweet belly tissues to feel like perfect bread dough or soft pizza dough. And if you've never made bread or pizza, that's your homework. You got to go make some so you understand what we're feeling for. And when you sit down and you relax, that's what your beautiful tummy should feel like. And the first time you do this, like 6 weeks post-open heart surgery, it's not going to feel like soft belly dough or soft pizza dough. It's going to feel like peas and carrots or like strings or like you're going to push on a spot. I have a little adhesion here. And like, instead of like, here's good, there's like a little weight. If you can see, great. If you can't listen, I'm pushing on one side of my belly and there's like a wave of tissue. And then I get to the midline and the wave stops and there's like a little divot in. I have an adhesion there. I can work on that gently. I keep it because it's perfect for demonstration purposes. And it's not causing me, right? And it's not causing me any functional issues. So I don't care. I keep it there. But we notice that. And then we do this for about 3 to 5 minutes while we belly breathe. And then we put our flat hand right over our belly button or a bit lower. And we do what's very technically called smushing. We push to the right and then to the left. And gentle pressure, whatever feels comfortable. We're never going to push into any like sharp pain. And I see what way it goes further. And usually it's going to go further in one direction than the other. That's the way I want to push to. I'm going to push into ease. So if I go left and then right, and it's harder for me to go right, I push into ease and I belly breathe for, again, 3 to 5 minutes. Friends, what this is doing, we have fascia throughout our whole body. Most of us are familiar with the IT band and the knee. That's a big band of fascia. It's gristly tissue. Fascia of the legs and the arms, like we can be kind of rough with it and it will respond. Fascia of your belly is protecting very vital organs. So if you poke in there aggressively, it will actually tighten further. And this is a contractile tissue that you're not in charge of. This is just something that happens. So if I do that smushing and I push to the left and push to the right and the right's hard and I just kind of try to force it, the body is going to sense maybe something's not right and it's going to keep tension. But if I smush into ease the way it wants to go and belly breathe, it says, oh, this is okay. And after 3 to 5 minutes, it will soften at that fascial level. And now you've reduced compression forces on these nerves that are going to your digestive bits, and your poop system's going to work better, folks. It's amazing. It's dang near a miracle. And it's minutes, not seconds. You could then repeat it in another direction. Usually we just tell people to do it like one direction at the start for time. And then the final piece of mobilizing all the nerves, we call colic massage. But in reality, we're not actually massaging the colon. The colon is the name for the large intestine, right? And typically there's this massage called I Love You, where you go here at your descending colon, here, transverse, and down. So you go down on the, rights and lefts, here we go. Down on the left side of your body, and then across and down, and then you make like a big U. But I think the way that we like to teach it a little bit better, forgive me, is we actually try to start down here at the sigmoid colon where Randy the rectum lives. And if we looked at the picture, it's that holding space for the poop that has to do 290-degree turns. Mm-hmm. So laying down, sitting with a relaxed tummy, you go deep to your low left side and you pull 3 to 5 times. If you have zero pain, you can do medium pressure. If this hurts for any reason, you can just do the lightest pressure, 3 to 5 times. And now we've kind of cleared the sigmoid colon to help the poop move better. And more importantly, we've cleared the nerves that go to the sigmoid colon to help it work better. That's actually what we're clearing. Following that, we do the descending colon. So we put our hands just below our left rib cage, push in and down into that sigmoid colon where we started the last one, and then we release 3 to 5 times straight down. And ideally, you're laying down or sitting down with a perfectly relaxed belly. Now I've cleared descending and sigmoid. So now I do transverse. I go from under my right ribs straight across 3 to 5 times. This might be the spot that's the most tenuous if we've had the sternotomy and the ports. So again, even the lightest pressure is fine, but we do want to restore normal mobility there. Second to last is ascending colon, which is lower right hip, pressing in and lifting straight up 3 to 5 times. And then finally the cecum, which is where your small intestine meets your large intestine, 3 to 5 times. And if we can do all 3 of those, oh my gosh, triple gold star, but even just one of them with the gentlest pressure can help that neurological system and help you have the best poops ever. And this is kind of like a lifelong thing that we can master it right now and benefit the rest of our lives. So I hope you enjoy it.
Oh, yes. And I guess order matters. Like if you're going to do all of them, you need to clear the bottom first.
There's a reason. An order does matter. And sunflower before smushing, before colic massage. Yes. And anything's better than nothing. So don't let, perfection be the enemy of good enough. Just touching the belly is going to matter in a positive way.
Wow.
I know,
Thank
right?
you so much.
Yeah, you are so welcome. Thank you so much for having me.
Yeah. This has been so enlightening, and I hope that for y'all listening that you will put this to practice. And this is free. Like you get to do this for free. And that's the whole point of the series and of this podcast is that I want to give you as much for free that you can do on your own in in the comfort of your own home or hospital bed to make sure you have the easiest path forward to healing as possible.
Absolutely. Absolutely. Well, thank you so much for having me, Boots.
Yes. And we'll have how to, Kelly, do you want to explain the courses again? You've been doing this great in every episode.
Oh yeah, absolutely. Okay. Yeah, thanks so much for having me. And if you guys are also interested in diving in a little bit more to the pelvic floor, I do have a wide variety of online courses available for streaming from the comfort and privacy of your own home. We're offering OHS 2025, open heart surgery, OHS 2025. You're going to get 25% off courses. Woot, woot. And there is, there's a lot that are very specific to surgeries or incontinence. And then there's the treasure chest, which is kind of all of my veritable knowledge. And that's where Poop Lab will exist. And that's the one that's all about poop. And that's fun because that's just a low monthly subscription rate. So we want to help as many pelvises as possible. Also, our Instagram has a lot of free, silly stuff. And the blog is also a treasure trove of information to help you have the best poop, pelvis, and heart of your life. So I'm so glad you're here, Boots. Thank you so much for offering me this chance to be on your show.
I just am here for the poop hat.
I have one at work too. I know that won't shock you.
Oh, wow. Well, you've heard it here, everyone. Thank you so much for being here. I hope you've been a part of this entire series. If you're just finding us thanks to poop, then welcome. We are so glad you are here, and be sure to go back and get the rest of the series. Because it's all such necessary information that I really wish I had when I was facing open heart surgery. So remember, I love you. You matter. Your heart is your best friend. Be sure to come back next week for more with open heart surgery with Boots.